Local 5 is asking Iowans about their experience with contact tracing after they tested positive for coronavirus. And a little refresher here. Contact tracing is the process of calling a COVID-19 positive patient and asking who else they may have infected before they got their test results. That's anyone who they were within 6 feet of for more than 15 minutes. Then they get the information of those people and call to encourage them to get tested and to self-isolate. Last week we spoke with contact tracers at public health departments. Tonight, Local 5's Eva Andersen speaks with several patients on the other end of that call.
So what's it like to be on the receiving end of a contact tracing call? I spoke with 3 different Iowans who each say it took them a different amount of time to get the initial call, and they each feel different ways about the process. So let's look at 3 COVID positive Iowans. The family of a 1-year-old in Story County, a 21-year-old college student in Blackhawk County, and a 36-year-old healthcare worker from Polk County. Now, 2 wanted to remain anonymous, so we'll start with the college student.
Right away, when I started showing the symptoms, it became very real.
Tyler is a student at UNI and got his positive test result June 26th. The next day, he got a call from Iowa Department of Public Health.
They basically just asked me, who have you come in contact with? Where have you been?
Tyler said he gave the contact tracer general information about where he had been, but he recalls they didn't ask for any specific information of his close contacts to notify them, which would be typically recorded on a form like this.
It's weird for me because I don't understand why they would want to be tracking it if they weren't going to do anything with that information.
Tyler notified his close contacts himself, including his coworkers.
I know what it's like to have to call people that you've been in contact with and how embarrassing those phone calls can be.
It's a different story for the 36-year-old hospital worker in Polk County. He got the call within 3 days, and unlike Tyler, he was asked to share contact information of people he'd been around, which is part of the process. But he says he didn't feel comfortable sharing the names of anyone or even the name of his hospital, saying, quote, "I told them that it was confidential and I would not disclose that information." Now let's look at the 1-year-old in Story County. 5 days after the positive test results, the parents still haven't received a call from a tracer. His mother is concerned with how the process is being handled statewide, saying, quote, "Story County has shown a lack of urgency in contacting our family." She says she and her husband have notified close contacts, including the daycare, but she worries the state doesn't have a way to hold accountable others who test positive and don't take the initiative to notify their contacts, including childcare facilities. A representative for Story County Health tells me that Iowa Department of Public Health is handling most of Story County's contact tracing. I reached out to IDPH and they said they try to reach out to each family within 24 hours of getting that positive result. So I asked them about that family situation with the 1-year-old, and I have yet to hear back. Reporting from Des Moines, Eva Andersen, Local 5 News, we are Iowa.